Do you get to know what allergies are and what it entails to manage them? Today, our major topic is going to be entirely on allergies. And when we talk about allergies, they range from the allergies that you know, from the upper respiratory allergies, food. So what I'm going to measure about any other allergen that it triggers a body reaction to react different, and we are going to talk about mostly about the today it's about, I'm going to measure more on the respiratory allergies that causes more cough or symptoms associated with the respiratory system. The commonest being allergic coughs and what can trigger them. So allergies can range from very mild reactions to very serious or fatal allergic reaction that can kill a person. And the commonest of them all is the just mild one that you can be able to manage as a person. You take anti-allergic drugs and then you get well. So wherever you are faced by, how will you know that you have an allergic cough? Allergic cough, they're consistent and they are recurrent, or more often they are recurrent because of mostly they are triggered by environmental factors like cold, dust, change of weather. So it's most cases that you know you are allergic because of the environment that you are in, and even including some things that we do at home that can be able to expose one to have an allergic reaction. So some common things that cause allergies, especially in babies, we say allergies are mostly genetical because some it runs in families, but there are others that can be someone is born with, or someone develops allergies later in life. So management of allergies ranges from simple treatment to serious treatment that requires serious medical attention, including admission. But the most commonest problems of allergy is something that you can manage because their symptoms are just mild symptoms like sneezing, having a recurrent dry cough, and running nose, or some rashes, skin rashes. Like if you take proteins and you are allergic to proteins, not all proteins someone is going to be allergic to. You are prone to, if you are an allergic person, you can be prone to an allergic reaction, body reaction, which will show that you will show by having skin rashes that are itchy. Sometimes they are big, sometimes they are small and numerous, red, and sometimes feverish. So, allergies, the whole mark of this topic is that allergies range from very mild reactions that one can be able to tackle at home or nearest a chemist, and serious ones that can take you to a hospital, including getting an admission for management depending on your body response to your allergy. So mostly people who do you have seen so many people using anti-allergic drugs like cetirizine and or Piriton and any other drug that you take to counter the reaction of an allergy, because they understand and they know they have an allergic reaction. But somehow you can do something or take something or be in a place that will trigger a reaction without your knowledge if you are allergic, and you end up having a very serious allergic reaction. Even your own body can have what we call an autoimmune allergic reaction. That's when your own body cells reacts to itself and causes a very serious fatal allergic reaction, which can land a person in an ICU bed because of the symptomatic presentation of one. So it's better to understand your type of allergy so that you can be able to manage, because somehow they might be just mild, but at some point they can get worse or they can disappear as well, depending on how your body is responding. So first of all, get to understand the kind of allergy. But then again, for me, I usually find it difficult for some people to understand exactly what triggers an allergic reaction to them, because we have so many allergens in the environment and in our where we are that really can trigger a reaction without you knowing is the one. Commonest being scents, strong scents, from perfumes, from lotions, and then another one is fumes and smoke from cooking or from industries. Another common allergic reaction that people get is from proteins that they take, majorly from animal proteins. So even if you enter a place and then find out that they are doing painting, there are people who react to the smell of the paint. So even animals' fur can trigger allergic reaction to some people whenever they are near, like for example cats and dogs. So allergic reactions are managed as per the severity of a problem. And if you're an allergic patient, be very cautious about what you eat and the environment, because even where you are can trigger a very serious allergic reaction. That said and done, next we are doing another topic, and I wish you the very best and have a very lovely evening. Thank you so much for listening.